I'm Drhardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is Mastopexy, or commonly referred to as breast lift. So, what happens with the breast? The breast is a complex organ consisting of breast tissue, skin, fat, and nerves. Obviously, they were designed to nourish the young baby. During this time, they become large and engorged. And what happens? The skin stretches out. So what happens is the skin bra is larger than the breast tissue. Therefore, the bra is larger and the skin sags and the tissue sags. Now, it can also be born with that. Some ladies just have more saggy breasts than others. But most commonly we see it after pregnancy. When the breast gets engorged, it goes up and down, and then they fall. I one time asked a lady what size she was wearing, and she said a 38 long. Well, what is the effects of that? The limitations are that the patient can't wear the clothes they would like. The nipple areolar complex is lower, the breasts aren't full, they can't wear a backless dress or bathing suits that they would like. So what do? What we do now is to sculpt the skin bra so that it goes ahead and fits the breast tissue. There are several different types depending on what the patient's anatomy is, what the desired look is, and what the final appearance they desire. First of all, it should not affect any sensation to the nipple areolar complex for erotic stimulation. Why? The nerve to the nipple comes from behind and under, and all we're doing is taking the skin out. It shouldn't affect the size of the breast much because it's only taking skin out. So the three types are what we call a periareolar. And what we do there is we take the skin out around the areola. If we need to, we make the areola smaller. And then we put a purse string. And when that purse string is tied, the nipple lifts up. But it does not do very much for shape. It sometimes even flattens the breast a little bit. So, operation number 2 is called the vertical or the lollipop. Why lollipop? Because that's the resultant scar. So we use operation number 1, we bring the nipple up, but then we put a dart in a horizontal fashion, and that brings the tissue together this way and lifts the breast up. Now, in those very saggy breasts, or the ladies that really want to have a lot of upper pole fullness, we'll do the inverted T or the anchor. Why is that? Because it has the circle from operation number 1, it has the vertical from operation number 2, but then it has the T from operation number 3. So there are darts on each side of the inframammary fold or the crease that we take the skin out. So each of these have scars, but in my practice and through the years I have found that scars are really secondary if the patient likes the shape. With our anti-scarring program that we'll be talking about in future blogs, the scars can be minimized. My whole goal is to be able to put a woman in a wet t-shirt and that the shape of the breast looks great and the scars are not noticeable. Now, what are the limitations? The limitations of the mastopexy is over time you'll never get that upper fullness. It always sort of dishes out a little bit. In that case, we'll go ahead and do a small augmentation. And it's not uncommon for a lady to want to be a little bit larger and to be perkier. We do the same operation as we do with an augmentation, and then we add the mastopexy. So in conclusion, the mastopexy is done because the skin bra is larger. And in all three techniques, we reduce the skin bra. The scars can be minimalized, and long term, we can get the shape that the patient desires based on their model photos. Thank you very much and hope to see you soon.